Good afternoon, good morning, good afternoon, and good evening, everyone. You're all welcome to ISSUP Nigeria webinar. And to this afternoon, we are unveiling the first artificial intelligence tool on screening brief intervention for Nigeria. And our speaker is an erudite scholar, and she's Mrs. Jane Egerton there. She's a tech executive, author, and the MD, Chief CEO of Nigerian Communication and Satellite Limited, NICOMSAT. That's a Nigerian leading agency managing the nation's communication satellites. Previously, Mrs. Egerton has worked at Meta, Avanti Communications, Ericsson, and Nokia Siemens Networks. She holds a degree in electronic engineering from the University of ISSUP and a master's from Warwick Business School, with executive training at Harvard and Yale. Her passion is in incorporating digital processes into day-to-day activities for improved outcome. With all pleasure today and with so much enthusiasm and joy in me, I welcome Mrs. Egerton on board. Thank you very much, madam.
Thank you much, Dr. Koyejo. Yeah, you can hear me, isn't it? Excellent. I think you can hear me.
Yes.
So thank you so much. Yeah. Yes, thank you. And I do appreciate this opportunity to share with the community. I think it's an amazing milestone of how technology can be used as a platform for good. Now I'm going to share my screen because, oops, trying to share my screen. Give me 1 second. I think I want to share my slides. 1 second. Yes, that's the right one. Yes, so today I'll be sharing on how we can actually leverage digital innovation for early addiction prevention. Now, before I start, I always love to tell stories. I think stories are a great way for things to stick. I think stories are a way for us to find content relatable. 2 years ago, I had a bit of crisis because a family member of mine became so addicted to gambling that it became disruptive, not just to his family. It also became disruptive to his work. He actually ended up losing his job. And when we were really analyzing the situation, I think I shared that with Dr. Koyejo because I was really heartbroken, and I've been since wondering, how can we help? How can technology help in early addiction or in prevention? I realized that one of the platforms that have really helped increase his addiction was actually a digital platform, because he will gamble online. And the bigger question is, how can we use the same technology for good? And today we are hoping to share our proposal and our belief of how you can use technology for good, to be specific, AI technology. And just to give you some context, and I'm sure a lot of people in this room probably can speak to this, that, you know, almost 300 million people, especially the age groups between 15 and early 60s, you know, have found themselves using drugs. Still, an increasing amount of people suffer from drug use abuse, almost 14 million. So substance abuse, substance use, those are actually issues that have always, you know, kind of lived with society for some time. But one of the ways that we can help is if we can find a way to identify early detection, it might be easier to prevent before it becomes a full-blown crisis. And if I take it back to where the challenge is, and the challenge is, like I said, the prevention. You want to prevent people from getting into these rabbit holes. And if I look at it from the African context, some of the challenges we've faced in doing this is things like late identification. And that could also be tied to stigma. In our culture, sometimes it's difficult to discuss this, you know, or to address it. So that whole stigma forces people to keep and live with their problem, just like the case of my relative. And it also just makes it a case of late identification, because they have lived with it for so many years. They have struggled with it for so many years. It has become a huge challenge. And some of the also challenges we've had is the workforce or the capacity to manage this with trained counselors, professionals. I am so grateful for ISSUP Nigeria because that has shown that we have actually taken a proactive stand, but we still do need a workforce. For a country as large as ours, 200 million, you can understand when I say we need a workforce. But same thing applies to many other countries globally. The bigger challenge is how can nations, how can countries really identify there's a need to intervene by building the right workforce to help them. And of course, you do have issues with uneven access. Uneven access will mean that sometimes and most times, this workforce, this access to professionals only exists in urban areas. If I go back to the case of Nigeria, over 70% of the population are actually in rural areas. So if rural areas don't have access to this and we have the issues of stigma, you'd have a huge problem on your hands. So those for me are some of the key things that have driven the prevention challenge. Why does the digital pathway matter? I can speak because I'm an engineer, because we tend to use technology. But we know that digital innovation has driven a lot of the sectors. Some of you might have heard about the fourth industrial revolution. It just speaks to how technology is blurring lines. Technology is affecting every sector. Healthcare, that's why you have health tech. Logistics, logistics tech. Education, ed tech. Technology in the fourth industrial revolution is touching almost every sector. So it becomes just a natural way to access interventions. We also can see that traditional systems alone cannot work. If you look at the current demand, the example I gave about the relative, he was actually introduced or he's exposed to this via technology. So the current traditional systems might not alone be able to address it. Then digital innovation has allowed us to reach places where we would not traditionally have access. Today, using a phone, we can reach people even in rural areas. Because if we can create connectivity and inclusive environment, we can reach them, even places where traditional banking services cannot reach. We have seen that digital banking services can reach. We can do the same when it comes to things like addiction prevention or substance abuse. We can still use this technology and make it inclusive to access or get these services to people in areas that traditional systems cannot reach. And of course, finally, it can be complementary. We can do both. In cases where we're using traditional systems, we can use digital systems to complement, because people can combine it. In the case where your counselor is not available physically, you are relocated, and you still need continuous service, we can digitally create an avenue for you to access those services. So it can be complementary in nature. So for me, a digital pathway becomes important in the 21st century, not just because we think it's a good way for us to access intervention, but because we can complement traditional ways, we can use it as an innovative approach, and of course we can run it in parallel with traditional systems. Then I also want to talk a bit about what these digital prevention tools can look like. A very easy one which we see happening and has been happening for about 2 decades is telecounseling, on the phones. People can access services, access counselors, access intervention services using phones or tele devices. Mobile apps have come along, especially on the African continent in the past 2 decades with the proliferation of mobile networks. We know that mobile apps have become a thing. People not just using tele services can also use apps. So they download apps on their devices. I know a lot of you here must have used the meditation app or a mental health app, so those apps are there to also help as an intervention. But we've also been able to work with professionals using virtual screening. Those are a bit more like a brief intervention tools where people can, instead of your traditional way of doing screening, meeting a professional, doing it on paper, we can do it virtually. Then of course, when it comes to monitoring, which is where AI plays a role, we can have data-driven monitoring. And I'll speak to that a bit when I do the highlight of the presentation. Now, I also want to speak a bit. I know it's a wide audience, but I started by telling you a story about a family member. I think when it hits home, it becomes personal, and our perspective and the importance is even more widened. And I want to share a bit of the Nigerian context. Over 60% of the population of Nigerians are youth. Now, you just think about that. These are young people living in an environment where the culture will induce some kind of stigma when it comes to things like substance abuse or when it comes to things like mental health. There's just a tendency not to want to talk about it or address it. But this is still the segment of the society that are digital natives. They're not afraid to try new things. They want to explore. This is also still the segment of the society that wants to try digital tools. They're just technology natives. They're so good at it. Nigeria has been one of the fast growing segments of the society when it comes to things like blockchain technology, because you have a lot of young people that want to try things. There's also for us a high unmet need because we don't have enough capacity for professionals to help us with early screening and prevention services. Now, we see this as an opportunity. I'm not just trying to say we have all these challenges. I think for us, it is an opportunity for us to look at a way to pilot a scalable digital first model to help reach underserved population. It could be underserved because we don't have digital access to them. It could be underserved because we don't have enough of welfare or professionals to access them. Any way we look at it, digital solutions start to look like an option to help bridge this gap. Now, I will give some examples of how emerging technology can help. Emerging technology, to be precise, are just technologies that we find to be disruptive. They are new. And sometimes when they are new, even regulators struggle to regulate them. But because they are new, they can be disruptive, but they can also be enabling because they become platforms to help us rethink the way we have used technology or digital services. One of the easy ones everybody's prone to, I'm hoping everybody on this call is chatbots. Can you give me a thumbs up on the chat if you've ever used a chatbot? I really am going to assume that a lot of people here have used a chatbot, but if you could drop a thumbs up. Have you ever used a chatbot? It could even be on a WhatsApp platform. It could be on an AI platform, ChatGPT, Claude, whatever. Have you ever used a chatbot? That is a good example how emerging technology can become very good in engagements. Something else that is also widespread, even on the African continent, is the use of telehealth. So traditionally, we have used that as a digital access method, especially for areas in the country that are not reachable, where you have doctors go log on to a mobile platform or a telecom platform, using their phone or their laptops, they can connect to patients remotely. We can also use that when it comes to offering services like this, professional services like mental health services, or services when it comes to substance abuse, addiction prevention. We can use this telehealth platform, and they're kind of good for counseling. They're good also for other things, but they are very good for counseling. With the emergence of AI, one of the good things we can also do is screening and risk assessment. I would like to speak to that in the demo, because this is a technology that has just taken some innovative leap in the past 2-3 years. And because of its ability to collect large data, discover patterns, it really helps in decision making. Now, we're not saying it should be the ultimate, but it can be a precursor for humans, for professionals to then make the final call. So AI is a great tool when it comes to screening and risk assessment. A good example as well where data analytics and AI comes into place, especially when we have population level risk monitoring or prevention planning, is the use of this data to also do what we call predictive analysis. So looking at patterns, because the tool is, or the platforms, especially when you put a bit of data analysis, is able to take all that data, look at the pattern, and even predict. So you could use them in population level risk monitoring and prevention planning. You could predict the potential or the high chances that certain things can happen in certain areas or within certain population, and it allows you to intervene early enough. So these are some cases where we can use emerging technology like digital tools, applications, AI, IoTs, mobile networks to actually solve and intervene. Now, what we have done, especially within the Nigerian community, is not only to talk about how we can use digital tools, is to actually show a real life example. And I'm very proud of the Nigerian ISSUP team for coming up with this great idea. So I want to show you a real life demo and how you can actually use a digital tool for substance abuse prevention and as well as early detection. Now we've called this tool the virtual SBI assistant. So a virtual screening and brief intervention assistant, because that's what it really is. It is not a doctor, it doesn't have the ultimate say, but it can assist the professionals and support the patients. I will then go and show a live demo. So give me a second. I'm going to show you a live demo of this tool. Okay, great. So I have here a live demo of the tool, which I'm going to show you. I think the great thing the team has done is to look at their work today and say, how can technology enable us make this work easier? Now, the way this tool has been created, it allows patients or intended patients or users of the service to either use it anonymously, especially in a community like ours where stigma is still a real thing, or use it and be happy to share data, which is use it and actually log in. When you log in, you give your data or some identifier that allows the tool save your historical data, so you can always come back to it and you don't have to, you don't have to do some of these things again because the tool already has your history. So you can say, hello, Jane, welcome. Let's continue from where you stopped. You get it. So I will start by, let's try using it anonymously. I think that will be better. So the way the tool has been designed, we start by a screening because I believe that's how the professionals would do it. You want to assess the situation before you decide the way forward. So right now, I'll start by clicking Start Screening. And like I said, you do have the option to continue as a guest, so you're anonymous. We only save some data for research purpose, so they can have data for research in future. Or you can log in where you actually create a profile, and we do have your profile. It is not, nobody needs to pay, it's free. And the target for this is a lot to do with the youths. Of course, we do have a data use and consent because of GDPR. It's important that people give consent. So I'll go here and click this and I'll agree to continue. That allows them to use your data. I will quickly fill this. So this is just a small brief. I know you cannot see, but it's just basically asking you about your, it's going to briefly ask you about your age, your gender, your location, that's where you're based. There's a drop down, so it already has the data, it's dropped down. I believe those online might not see the drop down box, but that's okay. I will ask you if you do have any religion, a religion you are affiliated with. I think it helps also in determining maybe your beliefs and value system. It also would ask if you're employed, that's also a drop down. It will also ask you about your sector, just to have a bit of indication. It will ask you about your marital status. That's all drop down. So I'm just quickly filling that so you see that. Then after that, it goes to something the professionals already use today, which is I think the World Health Organization the assist tool, but what they have just done is digitize it. So I will do a quick assessment. I believe those on the tool, already know this. I'll just quickly do that. Have you ever used tobacco products in your life? I'll say no here. Alcohol, yes. I do drink wine. Cannabis, no. Cocaine, no. So I just quickly fill this. I want to believe that you can see the screen. So I'm quickly filling this. Okay, so I'll continue. And of course, it goes on further to ask you a bit more details, once or twice in the past 3 months. No, not in the past 3 months. I'll do the same thing for a call in the past 3 months. No, no. Same thing here. Affected your health? No. I'm just quickly going through it, but Kojo, you could drop the link. Kojo, if you could help me, if you could hear me, you could drop the link on the chat box so people could try it out actually. But I'm quickly going through it. But if you want to try it, we will drop the link on the chat box and you can play around with it. So I'll go through this quickly. Alcohol sedatives, then this. Okay, there we go. Have you ever used any drug injection? No. So at the end, you do get some kind of result or the outcome of the assessment when it comes to substance use. And here it says low. Then of course we go to the next one when it comes to mental health. So I'm going to the next, and the next trigger is more mental health related question. And that's your PHQ-9 screening. So I believe a lot of you already know that. So all we just did is digitize it. Little interest, pleasure, not at all, plain time of depressed, not at all, trouble sleeping. Okay, yes, I do have, I'm perimenopausal, so yes, I do have trouble sleeping. Feeling tired, no. Poor appetite, no. Feeling down, no. Concentrating, no. No. So I continue, and there you go. At the end, you do have some kind of assessment about your mental health status. And that's a good way to start because I believe as a professional, that's what you would do, but this will help you collect it. And right at this, it will process both screenings. So the both screenings will be available to both the candidate or the patient that has logged in. Okay, there we go. So you do have it. So you can actually download the report. So if you choose to, there's ability to download it. You can dig in further by checking if you want to see in details what the screening about the substance use is related to you. Even below, one of the great things we've done is we also ask for feedback, so you can share feedback on how when you use the tool. Then there's one for mental health as well. So for the PHQ-9 you just did, we've gone ahead to give you a bit of assessment. You can share feedback. Then we talk about next steps. And I think that's the interesting part. This is really where now your chatbot intervention comes in. Now, one of the good things we've done with this tool is that we have gone and loaded every mental health hospital in Nigeria. So people can actually reach out, not just do the screening, they can reach out. And now if they want to talk more, they can now actually talk with the chatbot. Now this is your SBI. Okay, I understand. Yeah. This is your SBI virtual assistant. So there you go. Now, I don't know if I have too much time. We could have played around with the chatbot, but I'm looking at the chat screen. Please type your questions here. Should we play around with the chatbot? I don't know if I have more chatbot. We do have the chatbot. So the chatbot allows the guest, the patient, or the candidate to further explore. So they could ask more questions. What does it mean if I'm not sleeping well? What do I do? You could really ask more questions, and then you could get responses. And these responses is being based on the model being trained by the professionals of ISSUP Nigeria. So it's as close to as having the professional. Now the aim is not to use this as a permanent remedy, but to use it as an intervention tool, especially when it comes to early detection. And of course, the tool allows us to recommend to the candidate or the guest or the patient, proper steps he could take by seeing the professionals and giving him contact details of professionals he could reach out to. So that is the tool. I know we don't have much time, but we've put the tool, the link to the tool on the chatbot. You could go around, play around with the demo, play around with the chatbot. We would definitely love your feedback on it. then maybe I go back to sharing the presentation. We go back to sharing. So what I've just shared with you is what we call Nigeria's virtual SBI assistant, or screening and brief intervention assistant, a tool that would help both young, whoever they are, patients or candidates, and also help the professional body in really doing more like a prevention intervention for intended patients. But going forward, I think we all know that technology is, as it sits, is just an enabler. It is just a platform. It doesn't necessarily mean that all our problems are gone. So that means there's really an opportunity for collaboration and learning. This is the first pilot of the tool, so I cannot tell you it's a perfect tool. It has considered every situation, but it's a great opportunity for us as an international and global body to collaborate. Maybe adapt the models for different continents. Maybe look for public-private partnership in scaling the model. Maybe also look for ways to continuously evaluate, look at cultural relevance for different cultures, continents, consider safety, data privacy, efficacy. There's so much to consider. But what we have just given is a platform to do so much more. And that's one of the things I loved about what we've done. What we have just put on the table is an ability for us to think of using a digital platform to support the great work we are doing. So that said, and if I tie it back to my story about when it hits home, it becomes personal. When it hits home, it becomes personal, not only for me, but for ISSUP. That means there's a call for us to collaborate as a global body. I don't want to see this as a Nigerian tool, as a Nigerian ISSUP organization or group creating a tool. I want to see it as a call for collaboration to solve a global challenge, as a call for collaboration to create a digital platform that can have global impact, that can really strengthen prevention, reduction in stigma, expand access. Because one of the things I loved about the tool that was created, because when the guys were designing the tool and they kept insisting, they wanted the ability for people to be anonymous. It was a way to bridge the gap, especially in places like ours where stigma is still a thing. So in my conclusion, this is a call for collaboration. This is a call to say there is a way we can use a digital platform to actually continue doing the great work we're doing in the 21st century. Thank you very much.
Thank you very much, madam.
Thank you, Dr.
Dr.
Wow. Thank you so much, Mrs. Egerton, for this informative presentation. You've just highlighted how digital innovation can expand access to early substance use screening and strengthen prevention efforts, particularly in low-resource settings. We will now move into the questions and answer segment of the webinar. We are expecting participants to submit their questions in the box, and I will begin to read them out for our presenter to respond to. And also, we are going to try to address as many questions as possible within the time available. We are still expecting to get some questions. Okay, we have some, and I'm going to start to read them out. The first question is from Nimala Jagu. And Nimala's question is, how can one get this tool? Is there a cost for getting this tool?
So Nimala, I think that's an easy question. The tool, okay, there's an echo, sorry. If you saw when I put up the first page, it's actually free, it's at no cost. So if you go to the chat, I think on the chat group, we put the link to the tool. So it's at no cost. So if you click on that link, you would have access. It's on the chat bot. So if on the chat, if you go to the chat, you would have it. So it's at no cost. So if you just click on the link, you would have access to the tool. I think ultimately the goal is to probably put the tool on the global ISSUP webpage, but currently it's being hosted in Nigeria, so you can access it.
Thank you so much, Mrs. Jane. We have another question coming from Alison Crosby. Alison is asking, would it be possible for us to do this in our own country? Would we develop it from scratch, or would we be able to replicate this tool?
Thank you for that question. I think that's why in the summary I said this is really a call for collaboration. We are very happy to share. I think what we have done, which is peculiar to Nigeria, which are only the small changes you need to do. When this model was built as an AI model, we deliberately trained it with data from Nigeria. So you see, if you start chatting with it, if it's going to recommend a medical professional or a mental health hospital in Nigeria. So that's some of the things we've done. And one of the things we are also doing, we do have an LLM that has been built with local Nigerian languages. So that's the next phase. So the tool would allow you to also engage it in local languages, to do voice to text, text to voice. So you can speak as voice and to put it as text, or you can type it to respond as voice. But it can be done for any, these are just very easy things. It's just the same thing, the same tool, train it with your own data so it can have access to the mental health hospitals, mental professionals in your own country or ethnic group. And if possible, like I said, if you do have the ability to have LLMs with your own local language, we would do the same so that people can access the tool in your local language. I think it just reduces the barrier when people can do that.
Wow, that's an excellent answer. Thank you so much. We have another question coming from Subor Momand. Dr. Momand said that he is very, very appreciative to you for your presentation and also thanking ISSUP Nigeria for the great initiative. Then he mentioned that ASSIST has been developed by World Health Organization, and he's wondering if WHO is involved in digitalizing the questionnaire.
Thank you, doctor. So what we've done is just, since the professionals use it, we just digitize it. So it doesn't really, because you're just using the same information and accessing it electronically. But there are rooms to even further collaborate with WHO. So if we think that some of these questions could be adapted for local relevance, then let's have that conversation. And I think you professionals will better be suited to say that. Are there ways we could adapt these questions for more local relevance? Then let's do that, because I know, like if you looked at some of the questions, it was asking, have you ever used cocaine, opioids in the last 3 months? So probably if in your country it's not called cocaine or opioid, and we want to change it to the relevant word, those kind of nuances. But what we've just done is to digitize it, and digitizing it is not a difficult thing. It's just putting it electronically. But there's room to explore how to make it also locally relevant, and that's where I think working with WHO will be quite important. But Dr. Juboke, you can also add to that. I know you being a professional. You would have to unmute.
Sorry, I didn't get the question. Oh, is it Dr.
Okay.
Mr. Ejike?
Yeah, his question was that ASSIST was used in developing this, and he was asking if WHO was involved in digitalizing the questionnaire.
Yeah, it's in the open space, and it's the WHO instrument ASSIST is in the open space. We don't need any form of legal entity to do with them. So it's just picking an open document and digitizing it. So we are good to go. Thank you.
Okay, thank you so much, our president, Dr. Koyeje. Yeah, we have this one from Augustine Okori Ndoka, and he's thanking the presenter for an amazing presentation, and also affirming that it's true that technology can be leveraged upon to address SCD challenges in Nigeria and globally. And then we have this one coming from John Austin Perayo, and he's thanking you, the presenter, for your wonderful presentation, and ask if this can be applied in the Philippines, and how would this online option be sustainable with regards to costing in the long run.
Okay, so I think it's similar to an earlier question. Definitely can be applied any country. All we need to do is train it with your own data. That's what we did. And train is because you are collecting unique data, like I mentioned. I think some of the unique data that is in this tool that can be adapted for yours is if you do have a directorate or a directory of mental health professional, substance abuse or addiction prevention professionals, if you do have a directorate of that, of hospitals, of that can support, that data can be uploaded in the tool and it's localized for you. Then you also have the ability to convert your local language. It can also be put on the platform as well. But those are not difficult. And I think English is wide spoken, but this, because of AI, can easily become a tool in French. It doesn't cost anything to turn this back to French or turn it to a local Filipino language. That's what we are saying. So for it to be used by the Philippines is very easy. Now, the only thing we have done here, I'm going to put the caveat, we are hosting it in Nigeria for our own data privacy because we want that type of medical data to sit in Nigeria. So I guess in the case of the Philippines, you would host it if you do have a regulation that insists, we do have. So if you do have a regulation that insists that medical data stays within the country, then you would have to host, but the tool can be transferred anywhere.
Wow, that's amazing. We have this coming in from Chibozo Apere Essien, and he's thanking our presenter, Mrs. Jen, for an innovative exploratory presentation. He said that he's a student in Portugal and he's asking for a collaboration to expand it in Portugal. That's amazing. Is that possible?
That is very possible. Dr. Koyejo is here, and she definitely, I'm sure, Dr. Koyejo, I think there's an opportunity to collaborate with the Philippines, with Portugal, because this tool can be ported anywhere. It's an AI tool. You can use it anywhere. We'll be very happy to support any other country that is interested. So, Dr. Koyejo, I think I'll let those requests come to you, and from the back, we can always support to make it happen.
Thank you very much, Madam.
Hello, Dr. Koyeje.
Well, yes, thank you very much. We are open to collaboration and we want to thank everyone. So the whole essence of this is actually to serve humanity and for people to scale it up. It's a scalable tool, and we expect, we want and we desire collaboration, and this will really justify the huge work we've done. Thank you very much. Mr. Jikeme, over to you.
Oh, thank you so much, Dr. Koyeje. We have coming in from Abiodun Arogundade, and Abiodun is asking, thank you for your presentation and this great initiative. Would this tool be helpful in any way, in any shape or form to the family of the patient, e.g. signs to look for early detection of substance abuse? I think what he's asking is if this chatbot is going to be of any help to the family of individuals battling addiction.
Okay.
Yeah, thank you. Okay.
I will speak to Dr. Koyejo. one of the good things about the tool is the chatbot. The chat. Hello, can you hear me?
Okay, we can hear you now. We didn't hear you. You were off. Yeah.
Those are some of the uniqueness of what we face. That was a power interruption there. People in Nigeria can understand. So back to the question, I think this tool can really be beneficial even to the family of the, should we call it a patient? I don't know, maybe a patient is patient the right word? Because of the chatbot, because like, with chatbot, they're a good source of information. So especially for us Africans, because of stigma, we struggle to be very open in discussing these things. You could actually learn a lot by engaging the chat. But if you want to know challenges or signs of addiction, how you can help, you can engage the chat. But so it's not only for the patient. I keep calling it the patient, but I'm not sure if that's the right word, but even family members that really want to understand how to help, how to intervene, signs to look for, you can have that engagement with the child, and you can get those answers. And I think that can also help breach that barrier we have because of stigma, because people don't want to openly discuss this, but we're giving them an avenue to really learn and be informed so they can support their loved ones.
Yeah, yeah, very much in order. Okay, we have a lot of questions pouring in, and that's why somehow I've increased my speed. We have this question coming in from Rachel. Rachel is asking, how will this system manage people who screen positive for SUDs but are not ready to seek formal help?
So for substance abuse, I didn't hear that question well.
Yes, how will the system manage people who screen positive for SUD, substance use disorders,
Okay,
but are
okay.
not ready?
So I will speak then, Dr. Courage, I would like you to add to that. So one of the things we've done is create your ability to either log in and give us your data so we can actually access you, or be anonymous and you just give us generic data for research. Now, if you actually engage the tool, there will be recommendation. And like every tool, we cannot force you with a gun to the head, but we can nudge you. And because we can nudge you, we are hoping we can nicely convince you that you will have a safe space and you'll be given proper support, because we have the ability to help you, or we send you to places you can get support, because it allows you to be vulnerable, to share what your concerns are, and you can then address it. If privacy is your concern, or you don't want this information you share, all those kinds of things can happen with the tool. But I think another important thing is, because we do have your data, but that also depends, because if you don't give permission, we can also share. Because if you do log in, we do have access to your data. And one of the things we could do with the tool is encourage you to keep logging in, because we have your historical data. But like everything technology, we can't put a gun to your head and force you to always log in. But that's a good feedback, Dr. Creature. Maybe you could consider it, especially for people that have given us permission to have their data. If they screen positively, we can use digital tools like notification, to always send a notification, say, have you checked in today? How are you feeling? You could use notification to prompt them. That's a good way forward. But Dr. Creature, you can speak to that as well.
Thank you very much, Mrs. Jane, and thank you very much for the question. Well, the tool is screening and brief intervention. So there's a brief intervention aspect of it that even on your own, it will tell you some basic things you could do on your own to actually help you to be out of substance use. And like Mrs. Jane said, it's a scalable tool and we are hoping to add more to it over time. So with feedback like this, we hope to do more and help the people out. So we look forward to doing more things and improving on this too. But so far, for now, it's the screening and brief intervention. And if you use this basic brief intervention, it would really be helpful. Thank you very much. Thank you, Barrett.
Yeah, thank you so much. Yeah, thank you so much. I think the question is properly answered. And we have this one coming from Linani from the USA. And Linani is asking, in this regard, okay, in regards to confidentiality, how are records maintained securely?
So our record, so for one, because of the data, so we do have an NDPR policy. So that's similar to the GDPR for those of us that are in Europe. So that's a data privacy policy that regulates how we share and use data. So that requires, as per the government, that medical health records be stored locally. So this tool is currently being hosted on a platform owned by the Nigerian government. So we cannot host it outside the Nigerian, for the Nigerian, if we're using it for the Nigerian audience, we have to host their data locally. So we are doing that because it's required. And we're very confident where we are hosting it that it is very secure because it meets all the standards of our own NDPR, so our own GDPR, when it comes to cyber security, handling of the data, who shares the data, who owns the data, who uses it. So it won't be used for things like advertisement or marketing or passed on. We can only use it by the professional organization for research. So those things are all in check regarding the policy. So we are sticking to the national policy when it comes to the use of data. So in that sense, it is secure.
Wow, thank you so much. Here's another question coming from Subora, and it's asking, once the questionnaire is filled and results suggest that the person needs to see a provider, how easy is access to mental health and or addiction services in Nigeria? For instance, if a person called to the hospital you listed, what is the possibility that they can receive the required services?
That's a very good question. Really, like I said, technology can be a platform, an enabler, doesn't mean it's the ultimate. So one great thing we've done with the tool is list all the possible, mental health or professional access you can get for Nigeria. So for anybody that has screened positively, you will see it. I think I showed it on the page. But if you look at the page at the end of the screen, if you did screen positive, you see a long list of, it depends on what it is you screen positive for, the mental health professionals or substance abuse professionals. And that's coming from the ISSUP body. So these are certified professionals you can use. Now, in terms of going there, having service, ultimately we believe that because there's a passionate there's a passionate vision from the group to ensure that this actually is implemented. I do believe that when you do go for help, this data we have would allow us even give you help. Now, I cannot speak to when you reach the professional, are they going to give you 100%? But I want to believe that being professionals, they will do the job they are meant to do. But Dr. Kwejo, you can speak to it, but it will definitely get you into the door, into the room. Now, sustaining it, getting everything you need, I think that's a whole different discussion. But Dr. Kwejo, you can speak to that as well, because I know as an ISSUP body, you're making a lot of effort there.
Yeah, thank you very much. And well, there are enough professionals in Nigeria, and the government hospital we've listed there have the professionals to actually give the right services, evidence-based services. So I believe that if you walk in there, you get the right help. Thank you very much.
Yeah.
Okay, yeah, thank you so much. And we have Grescent. Grescent, Scholar Jane, thank you for the good job. How do we adapt with the tool as professionals without having ICT knowledge to scale up in school settings? I don't know if you understand the question.
I know.
How do we adapt?
How do we adapt as a, I would
with the
say that
tools.
with the tool, without having, one of the feedback I got, which is interesting, was from Kojo, was as soon as he logged in, he said, well, this is an interesting user interface. It is modern and it's easy. One of the things the team battled with when designing the tools, how do you make it easy to use, even for people that are not very literate? And you notice we've kept it simple. We've kept the landing pages or the pages simple, no distraction, the questions straight to the point, making it easy. And we're even going a step further to now do it in local languages. And that's to make sure that digital literacy does not become a barrier. So if you can use a phone, you should be able to use this tool. If you can read, you should be able to use the tool. And in the next phase, if you can hear, if you can listen to voice messages, voice notes, you should be able to use the tool, because we also understand not everybody can read. So those are the ways we are trying to make the tool inclusive, because we know that digital literacy could be a thing, especially for remote and rural areas where people are not so literate or not so educated. But we're trying to simplify the tool to say, if you can use a basic terminal, if you can send a WhatsApp message, that's the minimum barrier. Either you send it by texting or using voice, you should be able to use the tool. So that's one of the ways that in designing it, one of the strong things they've considered in simplifying it.
Wow. Okay, we have this one. Please, Dr. Koyeje, how much time do we still have to take questions? Because we have a lot of them here.
Thank you very much. Let's have 5 minutes, then you do a summary, then we'll close. The questions, I've seen them, there are so many. Well, people love this too. Mrs. Jane, thank you very much. You can see Nigerians are interested. And let's do 5 minutes, 5 more minutes, and you do a summary and we'll close. Thank you.
Okay, thank you so much. We have this coming from Chinedu Eze, and he's asking, can this be used in program delivery sessions for detection of early vulnerability, risk, trends in young people? I'm into program delivery.
I will say that is an excellent use case, because there you're trying to work at scale. So imagine if you are engaged with a group of 300, 200 youths, and you have to screen them. If you use the tool, you will screen 300, 200. If they have a phone or a laptop, you can screen them in 10 minutes. And everybody has to do download their report and send, and that's it. So it will make it more efficient for the professionals, because it's really going to be time saving, and they can look at this report and take it from there. So I'll say that's an excellent use case. That's a very good question. Dr. Koyeje, do you want to add to that? That's a very good use case.
Well, I think you've answered the question, so let's move on. Yeah,
Oh,
I think you've answered it. Thank you very much.
Okay, a lot of people are asking for the link. Yeah.
it's in the chat.
Chat
I think we
also,
put it in the chat.
I think it's going to be sent out to them too, because it's going to be attached when the webinar is published. The link is going to be attached there. So definitely everyone is going to have access to the link. And we have a lot of people really expressing their appreciation. We have this one coming from Mary Mila Bubo, and say, thanks, Miss Jane, for your amazing presentation. We also have this one coming from Jafar Salisu. Say, thank you so much, our presenter. And then Nimala is also asking another question, and his question is, how can we set up this tool in other countries? I think a similar question has come up earlier. Do you still want to comment on this, Mrs. Jen?
I think just reach out to Dr. Koyeje. We want to collaborate, because what we will just do is train the tool for your country. So take data of your own professionals and load it there. So when people log in from Philippines and they need access to help, they will see hospitals in Philippines and professionals in Philippines, not the ones in Nigeria, because we can tell that that's where they are from. So that's a great way to collaborate. And I would say use it, because the more we use it as AI, the more we train the tool. And please share your feedback, because I love some of the questions. It's also giving us ideas on how we can improve it. Like the person that asked about, if someone had a positive SBC, how do you ensure that they get help? And one of the ways to ensure is also to use technology to really push them. Keep sending them notifications and encouraging them. Have you seen a professional? Do you want me to recommend one? How are you feeling today? Things like that. Just nice ways to nudge them. So they're really great questions. I would say, if you want to be able to use the tool for your own country, speak to Dr. Koyojo. We will try and make that happen for you.
Okay, yeah. This one is coming from Jafar Salisu, and is asking, what are the most significant barriers to implementing universal addiction screening across various healthcare settings, and how can they be overcome?
That's a good question. I think in the presentation, we somehow addressed it, where the barriers we see. We know that the traditional means alone cannot help. I think we mentioned that the technology or digital access can be used to complement it. And we know that sometimes countries, nations, continents do not have enough workforce or professionals to meet their demand. And just like the use case somebody asked, if you had to engage 300 youths, the amount of professionals required to access all of them, then engage them, is quite a lot. But with technology, you can make sure the assessing part is easy, then you can move on to the next phase. So capacity, not having enough capacity, is been traditionally a challenge. So not having enough capacity, complementing traditional ways, those are some of the barriers in the past that have been there. And that's what we are hoping that this tool can support to help bridge that gap. Then, of course, stigma. I think we already talked about that a lot. A lot of, especially if I speak to Nigeria, people don't like talking about mental health. People don't like to say they are depressed. People don't like to say they have a problem with substance abuse. People want to just deflect it or ignore it or pretend it doesn't exist. But we are giving them a safe space to seek for help, where they won't be judged. If they want to even show up anonymously, they can show up anonymously, because what is important for us is that they get support and help. Nobody wants to judge them. And that's the important thing of bridging that gap.
Wow. Rufus Ashiro is saying, thank you, Madam Jane, for the presentation. This will help a lot with our field work. And then James Gabriel Lungu is saying, I'm interested. How do we make use of this tool here in Zambia? And we have this one from James Nondi, and he's saying, quite an interesting innovation, something that for sure can be adapted here in Kenya. Thanks for the presentation. Time will not permit us to take much questions. We have quite a number of them. We are coming to the end of the webinar, and would like to thank our presenter for sharing valuable insights on how digital innovation can really strengthen early prevention efforts in substance use care. Today's discussion highlighted the importance of early identification and intervention, especially in contexts where stigma, limited resources, and access barriers often prevent individuals from seeking help. And so we also explored how digital tools, such as Nigerian virtual screening and brief intervention chatbot, can expand access to confidential screening and support while complementing existing human-centered services. This session has also reminded us that while technology can enhance prevention strategies, its success depends on ethical design, cultural relevance, and collaboration across sectors. On behalf of my president, Dr. Koyoje, and the entire executive of ISSUP Nigeria, we sincerely thank our presenter for an amazing presentation. We also want to thank all participants for for joining us and contributing to today's engaging discussion. We hope that the ideas shared today will inspire further innovation and collaboration in advancing substance use prevention globally. So at this juncture, I want to say thank you all for your participation, and we look forward to seeing you at our next ISSUP Nigeria chapter webinar. Thank you so much. My president.
Thank you very much, Mr. Ejikeme. I want to thank Mrs. Jane Hegetini for the job well done. We really appreciate the work you have done. Well, I would want to thank all the people that developed this tool. I want to appreciate Publica AI, NICOMSAT, we cannot thank you enough. And my team members, I want to mention their names here for the world to hear, people behind this work. Mr. Bashir Ibrahim, Dr. Oluwashikemi Alalade, Mr. Ejikeme, our secretary, Dr. Chinemere Nwayanwu, Dr. Ajayi Oluwatomiwa, Nurse Josiah Okeshola JJ, Dr. Saadatu Adamu, Mr. Samuel Dakwak, Ms. Moriri Oluwa Akinola, and Mr. Olusegun Samuel Kayode. All of you, I cannot thank you enough for working day and night to make this today a reality. I'm proud of you. Mrs. Jane Egerton Ide, I really don't know how the passion you have to support people, to support others. I want to say a big thank you to it. And Publica AI, a big thank you once more. And to all the people on this program today, we appreciate you all. Thank you very much. And in 2 months' time, we have something new to present to the world again. Thank you very much. Bye. So bye, everyone. Thank you very much.